There would be enormous benefits to the economy in regulating drugs. I mean, first of all, the cost of policing drugs in this country is one of the biggest costs to policing. One estimate that I've seen is about 7 billion a year. I don't know how accurate that is. It's a very difficult thing to quantify, but I think most people, senior management in policing that I've spoken to, would say that it's possibly the biggest cost to policing. It's certainly the biggest cost to policing if you take into account the fact that 50% of acquisitive crime is committed by the small number of people who have a problematic experience with heroin and crack cocaine. If those drugs were treated as a medical regulation, so in other words, if a heroin addict was given heroin in the first instance, before other treatment options were considered, then you would literally eliminate 50% of acquisitive crime overnight. And that is an enormous policing cost reduced. If the drugs that it was appropriate to tax, so you had a regulatory model which you could tax them, for example, MDMA, cannabis, those kind of drugs, if they were taxed, it is estimated that it could bring in £7 billion a year to this country in taxation, which is more than was used to bail out the entire Irish economy by the European Union when they crashed. So we're talking enormous amount of money per annum. Of course, we in this country use, in terms of our drug policy, that there is a division between how much is spent on health, how much is spent on policing. In this country, we have an 80% of our drugs budget spent on policing, 20% on health. If you look at the experience of Portugal, where they have put virtually 100% of their drug policy budget on health, they have reduced deaths and all of the health service costs of the harms of drugs. So they've made enormous savings in the health service because of the way that their policy has gone. So it's almost every aspect of public policy in which you save money by switching from a prohibitive policing model to a health model.